Gotten a rec for a 5U knee series. I come over here and I scan it into the computer. Just make sure everything's correct, that you have the views. And when you do scan the cassette, you make sure it comes up under the right view. For AP, oblique, and lateral knee, if the body part, the pelvis, is less than 19 centimeters, then you angle 3 to 7 degrees cotted. If it's 19 to 24 centimeters, the central ray is perpendicular. And if the pelvis is greater than 24 centimeters, then you angle 3 to 7 degrees cephalic. So I've gotten a rec for a knee series. There's going to be 5 views. There's going to be an AP, a medial oblique, lateral, the axial intercondylar fossa, and a patella. So first what I'm going to do is I'm going to come set up my console. So my kV is going to be at 80 kV and the mass is going to be anywhere from 6 to 20. I have it set to the table bucky and it is on AEC. So next what I'm going to do is I'm going to come over and set up my ring. My tube is detented transversely. I'm going to put my distance at 40 inches. I have a portrait cassette in here. It's 10 by 12. I have my right marker because it's going to be her right knee. There's a strip on the film and it's going to be facing towards her head. So I'm going to go get my patient. Hi, my name is Katie. I'm going to be taking her knee x-ray today. Yeah, and I do have my patient change into a gown so I can see her knee. What is your first and last name?
Brianna Clark.
Okay, and your birthday?
10/2/89.
Okay, is there any chance you could be pregnant?
No.
Okay, so come with me. And how did you hurt your knee?
I was playing volleyball.
Okay, now she's going to get up on the table. I'm going to make sure I shield her. Okay, so now I'm going to make sure my tube is detented longitudinally. I'm going to center the patient, the knee ½ inch below the patella. And I'm going to make sure my collimate to her knee. I'm going to make sure her foot is straight. And now I'm going to take the x-ray. X-ray. I've ran my AP knee. I'm going to use the same size film and the same direction lengthwise. For this one, I'm going to have her rotate her knee in 45 degrees, and it's still going to be centered at ½ inch below the patella. And then also, we're gonna have our central ray perpendicular because her pelvis is in between 19 and 24 centimeters. So I'm gonna go take this x-ray. X-ray. Okay. And now I'm gonna go run this other film. So now we're gonna do a lateral knee. We're still gonna use the 10 by 12 and lengthwise. So for this one, I need to center 1 inch distal to the medial upper condyle. I want to make sure that her hips are straight and that this knee is in front. X-ray. Interior condylar fossa view, I'm going to change my kV to 70 and the mass is going to be 6. My last film, and now I'm going to use the Vauclair method for the intercondylar fossa. I have the patient, she's flexing her knee as much as she can, and I do need to build it up to reduce the OID. I'm going to use an 8 by 10 film this time. And the central ray is going to be perpendicular to the angle degree of her tib fib. The central ray is entering ½ inch below the apex of the patella. Ran my last film, so now we're going to do a tangential view of the patella, also called the Setagast. My technique for this is going to be 70, and the mass will be anywhere from 1 to 5. So now I'm going to have the patient hold the cassette, and the tube is going to depend on the angle of the knee and the cassette. And it's going to enter, the central ray is going to enter the patellofemoral joint space. And this is also going to be on an 8x10, and you collimate to just the patella. Okay, X-ray. Okay, now I'm going to go run my last phone. 5U knee x-rays pulled up on the screen. There is some criteria that we need to meet to make a diagnostic image. So for the first one I have pulled up is the medial oblique knee. The tibia and the fibula need to be separated at this proximal articulation. You should see that space. Both of the tibial plateaus and the tibial eminences should be seen. The patella should also be superimposed on the medial side of the femur. You also want to see this middle joint space between the tibia and the femur. Okay, for the AP knee, the joint space should be open here, the femoral tibial. The knee needs to be fully extended. You want the interspaces, these interspaces, to be equal on both sides. The patella should be superimposed over the femur. There should be no rotation. And also the fibular head right here should be slightly superimposed on the tibia. Now on the lateral knee, the femoral condyles should be superimposed over each other. You want this femoral patellar joint space to be open. You also want the joint space between the femur and the tibia open here. The patella should also be seen as lateral. Now for the intercondylar fossa view, you want to make sure you see this fossa open, nice and open. You want to be able to see the tibial eminences, and yeah, this knee joint completely open, and you don't want to have any rotation. For the last, the sunrise or the tangential patella view, the femoral articulation needs to be open right here, this joint space, and also the surfaces of the femoral condyles should be seen, and you should have, in all of the views, there's evidence that there's collimation and your markers are always on there, and this makes a proper diagnostic image for the knees.